Hello and welcome to another edition of Coffee with Polio Experts. My name is Joe Swan and today I'm here with Dr Arlene King, who's Chair of the Regional Certification Commission of the Americas and Chair of the Containment Working Group. Good morning, Dr King.
Good morning.
Welcome and thanks for taking time to be with us here today.
You're welcome.
So we're going to be talking a little bit about poliovirus containment, a very serious, a very important issue. Dr. King, maybe to start with, can you tell us a bit about yourself? What do you do when you're not involved in these commissions, these groups?
Yeah, so I'm an adjunct professor at the Dalla School of Public Health at the University of Toronto, and I'm the former Chief Medical Officer of Health for Ontario, Canada.
Excellent. So maybe to start with, can you tell us a little bit about poliovirus containment? So why, we're trying to eradicate polio. Why would we want to hang on to, why would certain countries want to hang on to poliovirus after it's eradicated?
Well, once we have eradicated polioviruses from the human population, the only place that polioviruses will remain are in facilities like laboratories or manufacturing facilities in order to use them for either research purposes or for vaccine manufacturing. And it's really important that once the population is free of polioviruses that we don't have any leakage or spillover from those facilities back into the population.
Right, and what would be some of the consequences if there were to be, a breach or a spill? What could happen?
Well, the concern is that particularly once there is a very low level of immunity in the population against polioviruses, that those viruses could actually spread extensively in the human population, resulting in widespread illness and paralysis, particularly of children.
Right. So it could potentially undo a lot of the work that's been done.
Absolutely. There have been huge investments, billions and billions, in excess of $50 billion invested in polio eradication. So we absolutely don't want any of those viruses that are being kept to escape back into the human population. Right.
And so what's happening? What are we doing to make sure that these viruses are locked up?
Well, we've basically in 2018, there was a resolution at the World Health Assembly asking countries to accelerate their either destruction or containment of any polioviruses, particularly poliovirus type 2, which actually has been eradicated from the human population. So that's the first initiative, is getting rid of as much as possible and then containing those viruses. And the blueprint for the containment of those viruses is contained in a document called GAP3. And that document describes the way in which you contain polioviruses, and it's essentially threefold. It is ensuring that those facilities that have polioviruses are appropriately managed and managing that virus. The second is by maintaining high levels of immunity, particularly in the area those facilities exist. And the third is ensuring that the sewage disposal facilities, the sanitation, is appropriate to ensure that there isn't any spread if in fact the virus was emitted or released from that facility. So it's kind of a threefold, three-step approach to try to fill as many potential gaps as possible.
Right. So it sounds like a very ambitious and costly undertaking.
It is.
Are countries committed to doing this, to implementing GAP3?
They have committed to implementing it, and they have again in 2018 committed to accelerating that process because, as I said before, we've actually eradicated one poliovirus from the face of the earth and we've got two more to go, and so we need to ensure that we lock up all those polioviruses that remain in facilities, poliovirus type 2 in particular, that remain in facility, and then get working on doing inventories of where we have those other two polioviruses, types 1 and type 3.
Right. So I guess, polio is being used for vaccine manufacturing, research. I've read that, it's being used for cancer research and things like this. So these are facilities or labs, that know that they are working with poliovirus. What about those that may, have collected, say, stool samples from from children with other kinds of infections, with other kinds of conditions. What's happening to, check their stocks?
Well, one of the recent documents that was put out was really targeting those kinds of facilities, those facilities that may have polioviruses and may not know it. So, as you mentioned, those facilities that might be working with influenza viruses or with stool specimens that were contaminated with polioviruses. So that document was meant to raise awareness among all facilities to ensure that they go through a process, a rigorous process to determine whether they actually might have polioviruses and how to manage that situation should that be the case.
Right. And maybe can you give us an idea of how many countries or maybe how many facilities around the world are looking to hang on to poliovirus after eradication?
Well, the number is in flux. There are always countries doing reassessments of whether they actually need to keep polioviruses or not. But right now, there are 28 countries and over 90 facilities that are designated by those countries to retain polioviruses.
Right, so that sounds like a high number.
It is, and I think one of the key messages is unless it's absolutely needed, nationally or internationally, for research or for production of vaccine, polio vaccine, the country should eradicate it, get rid of that, destroy that virus. Because everywhere there is a virus being retained, there is always a risk. Even with good containment measures, there's always a potential risk of that virus escaping. And so I think that's the first line of defense, is getting rid of as much poliovirus as possible.
Right, great. And maybe one last question. Since we haven't yet eradicated, type 2, you mentioned, has been eradicated. Types 1 and 3 are still, haven't been declared eradicated. How urgent is containment? Are we not putting the horse before the cart? Or, how soon do we need to get moving on this?
Well, clearly, having contained or destroyed polioviruses type 2 is urgent, and in fact, we're overdue in terms of really ensuring that destruction has occurred or that containment has occurred. With respect to the other ones, because it is such a complicated process, we want countries to do the same kind of inventory as they did with their polioviruses type 2 and at least take stock of what they've got, and then if they are not planning on retaining it, to again destroy as much as possible. So it is a lengthy process, and so we want countries to get rid of as much polioviruses as they can right now, so that once we do declare eradication of all polioviruses, that process will be well underway, if not completed, in fact, by the time that eradication declaration occurs. And of course, we don't exactly know when eradication will be declared, but the time is now to get rid of as much polioviruses in those facilities as we can.
Sure. So destruction is the safest way.
Exactly. Absolutely.
Thank you very much, Dr. King.
You're very welcome.
Very, very enlightening. And thank you very much for being with us here today. And hope you join us again for another edition of Coffee with Polio Experts. Thank you.